Most welcome in this video. Excellent choice. Bye there. The gross anatomy of the liver is one of the most clinically and surgically significant topics in abdominal anatomy, especially for medicine, surgery, and radiology at the graduate level. Below is your complete AZ summary, built at postgraduate anatomy depth, with surface features, segments, blood supply, peritoneal relations, and clinical insights. Gross anatomy of the liver, graduate level. 1. Overview. The liver is the largest gland in the human body, to 1.5 kilograms in adults. It functions in metabolism, detoxification, storage, bile secretion, and blood filtration. It lies mainly in the right hypochondrium and epigastrium, extending slightly into the left hypochondrium. It is intraperitoneal, except for the bare area on its posterior surface. Thank you for watching this video. 2. Position and shape. Wedge-shaped, with a base, posterior, and apex, anterior. The diaphragmatic surface is convex, fitting under the diaphragm. The visceral surface is concave, molded to adjacent organs. 3. Surfaces. A. Diaphragmatic surface, smooth, convex, in contact with diaphragm and ribs. 7. 11. Subdivisions. Superior surface, fits under diaphragm. Anterior surface, behind costal cartilages. Right surface, contacts diaphragm. Posterior surface, includes bare area, no peritoneum. B. Visceral surface, irregular and concave, related to stomach, gastric impression. Right kidney and suprarenal gland, renal and suprarenal impressions. Colon, right colic flexure. Duodenum, first part. Gallbladder fossa. 4. Lobes of the liver, anatomical division. 1. Right lobe larger. 2. Left lobe smaller. 3. Caudate lobe on posterior surface, between IVC and fissure for ligamentum venosum. 4. Quadrate lobe on inferior surface, between gallbladder fossa and fissure for ligamentum teres, is greater than. The falciform ligament divides the right and left lobes anatomically, not functionally. Functional. Physiological. Division based on blood supply and biliary drainage. The plane between the gallbladder fossa and IVC divides the liver into functional right and left lobes. Couinaud's classification. 5. Ligaments of the liver. Ligament type description. Falciform. Ligament peritoneal fold. Connects liver to anterior abdominal wall and diaphragm. Contains ligamentum teres. Coronary ligament. Peritoneal reflection. Attaches superior surface to diaphragm. Encloses bare area. Triangular ligaments. Peritoneal folds. Right and left ends of coronary ligament. Ligamentum teres. Hepatis fibris remnant obliterated. Left umbilical vein. Ligamentum venosum fibris remnant obliterated ductus venosus. 6. Peritoneal relations. The liver is almost completely covered by visceral peritoneum, except bare area, posterior, adjacent to diaphragm. Gallbladder bed, porta hepatis. Entry point of hepatic pedicle. 7. Porta hepatis, hilum of the liver. A deep transverse fissure on the inferior surface between the caudate and quadrate lobes. Transmits the hepatic triad from posterior to anterior. Right and left hepatic ducts, bile outflow. Right and left branches of hepatic artery proper, 25% blood. Right and left branches of portal vein, 75% blood, is greater than. Also contains lymphatics and autonomic nerves. 8. Blood supply, arterial hepatic artery proper. From common hepatic artery, celiac trunk. Divides at porta hepatis into right and left hepatic arteries. Right hepatic artery gives off cystic artery to gallbladder. Venous portal vein carries nutrient-rich blood from the GI tract. Divides into right and left branches at porta hepatis. Hepatic veins, 3 major, right, middle, left. Drain into IVC at the posterior surface is greater than. The liver receives a dual blood supply. 75% from portal vein, nutrient rich. 25% from hepatic artery, oxygen rich. 9. Venous drainage central veins, sublobular veins, right, middle, and left hepatic veins inferior vena cava, IVC. No valves potential for spread of infection or metastasis between portal and systemic systems. 10. Biliary apparatus. Gross overview. Right and left hepatic ducts join to form common hepatic duct. Cystic duct from gallbladder joins it common bile duct. Common bile duct passes posterior to first part of duodenum and through pancreatic head to open into the second part of duodenum. Ampulla of Vater. 11. Segmental anatomy. Couénard's segments 8 functional segments, each with its own portal triad. Artery, vein, duct. 1. Caudate, lobe, eye. 2, 4. Left lobe segments 5, 8. Right lobe segments is greater than, used in segmental liver resections and radiological mapping. 12. Lymphatic drainage superficial lymphatics, from capsule hepatic lymph nodes celiac nodes. Deep lymphatics, from portal triad celiac nodes. 13. Nerve supply hepatic plexus, sympathetic plus parasympathetic, accompanies the portal triad. Sympathetic fibers, from celiac plexus vasoconstrictor. Parasympathetic fibers, from vagus nerve secretomotor to bile ducts. Sensory pain fibers travel with sympathetic nerves. T6, T9 dermatomes right shoulder pain referred via phrenic nerve. 14. Surface markings upper border. 5th rib, right MCL. 5th ICS, left MCL. Lower border, right costal margin, left 6th costal cartilage. Right lobe, protected by ribs. 7, 11, 15. Clinical correlations. Portal hypertension, due to obstruction in portal circulation. Esophageal, umbilical, and rectal varices. Cirrhosis. Fibrotic. Replacement nodular liver surface. Hepatic segments guide partial hepatectomy. Subphrenic abscess, between diaphragm and liver. Referred pain, to right shoulder. Phrenic nerve. C3, C5. Summary mnemonic structures at porta hepatis. Duct, artery, vein. DAV, anterior, posterior. Liver lobes, posterior view. Caudate above, quadrate below. Bare area boundaries, formed by reflections of coronary ligament.